of this video lecture is additive and supra-additive effects. Additive effects. Here the effects of the two drugs simply adds up. Let's say there are two drugs A and B. So the effect of the combination, that is A plus B, is equal to effect of A plus effect of drug B. So the effect of combination is equal to sum of the individual effects of the drugs. Secondly, this addition is possible only when the drugs are acting in the same direction. That is, they produce the same response. And it is also to be noted that only the therapeutic effects gets added up, but not the side effects. So instead of giving a higher dose of one drug, which would possibly lead to toxicity, combination of drugs would produce therapeutic effects associated with a lower incidence of side effects. By combining the drugs, the incidence of side effects is reduced, but the therapeutic effect is increased. Example, aspirin and codeine produces analgesia. Aspirin, by inhibiting prostaglandin synthesis, produces analgesia, whereas codeine, by acting as an agonist at the opioid receptors, causes analgesia. So, aspirin and codeine when combined together produces greater analgesic effect. Next example, combination of nitrous oxide and ether for anesthesia. Nitrous oxide has an anesthetic effect and ether also produces anesthesia. So, when both combined together produces a greater anesthetic effect. The next example, theophylline when combined with salbutamol produces greater bronchodilation. Theophylline, by inhibiting the phosphodiesterase enzyme, increases the concentration of cyclic AMP, which causes bronchodilation. Salbutamol stimulates the adenylate cyclase enzyme, which increases the cyclic AMP formation and produces bronchodilation. So, both salbutamol and theophylline when combined together produces greater bronchodilatory action. The next example, atenolol is a beta blocker. It blocks the beta-1 receptors of the heart, decreases the cardiac output and exerts antihypertensive action. Amlodipine, on the other hand, is a calcium channel blocker which blocks the entry of calcium ions, causing vasodilatation and a fall in blood pressure and exerts an antihypertensive action. So atenolol when combined with amlodipine produces a greater antihypertensive effect. A combination of metformin and glimepiride as anti-diabetic drugs. Metformin exerts anti-diabetic action by increasing the peripheral utilization of glucose and inhibiting gluconeogenesis in the liver. Glimepiride is a sulfonylurea and acts on the pancreatic beta cells and stimulates the pancreatic beta cells to produce insulin, which causes peripheral utilization of glucose and exerts anti-diabetic effect. So, metformin when combined with glimepiride exerts a greater anti-diabetic effect. So, this is known as additive action. Next is supra-additive effects. Here, the effect of the combination drugs, that is A plus B, is greater than the effect of A plus effect of B. It is also known as synergism. Syn means together, ergon means work. So working together they can produce a greater therapeutic effect while the side effects are reduced. This is also known as potentiation because the action of one drug is facilitated or enhanced by the action of another drug, and the combination is known as synergistic combination. Example, in a combination of levodopa and carbidopa, carbidopa potentiates the action of levodopa. Levodopa is a prodrug or inactive drug, gets converted in the periphery in presence of dopa decarboxylase into dopamine. Dopamine cannot cross the blood-brain barrier, and accumulation of dopamine in the periphery causes side effects. Carbidopa, by inhibiting dopa decarboxylase, inhibits the conversion of levodopa to dopamine in the periphery, thus increasing the concentration of levodopa, which enters into the brain as it readily penetrates the blood-brain barrier and gets converted to dopamine in the brain. This is useful in the treatment of Parkinson's disease, which is characterized by deficiency of dopamine in the brain. Levodopa, by getting converted to dopamine in the brain, is useful in treating the symptoms of Parkinson's. Next example, a combination of adrenaline and cocaine. Cocaine blocks dopamine transporter, preventing the reuptake of dopamine into the neurons, resulting in dopamine buildup in the synapse. Dopamine in higher doses stimulates the adrenergic receptors, that is alpha and beta receptors, producing adrenergic effect, that is positive inotropic effect and chronotropic effect. Therefore, cocaine along with adrenaline increases the overall adrenergic effect. Next example, combination of sulfonamide and trimethoprim produces sequential blockade in the synthesis of folic acid, which is necessary for bacterial multiplication. Individually, the drugs are bacteriostatic, but combination produces bactericidal effect. The steps in the synthesis of folic acid are: pteridine combines with PABA to produce dihydrofolic acid in presence of folate synthetase enzyme. The folate synthetase enzyme is inhibited by sulfonamide. The next step, where dihydrofolic acid gets converted to tetrahydrofolic acid in presence of folate reductase. Folate reductase is inhibited by trimethoprim. Sulfonamide, when combined with trimethoprim, inhibits folic acid synthesis and bacterial multiplication. The next example, combination of captopril, which is an ACE inhibitor, with a diuretic. Captopril, by inhibiting ACE enzyme, inhibits the formation of angiotensin II, which is a vasoconstrictor, thereby causing vasodilatation. They also inhibit aldosterone synthesis and is responsible for the loss of water and electrolytes. Hence, captopril, by causing vasodilatation and loss of water and electrolytes, causes a fall in blood pressure and acts as an antihypertensive agent. Diuretic exerts antihypertensive effect due to intravascular volume loss, and secondly by vasodilatation, which is a long-term action. Therefore, diuretic and captopril, by acting through different mechanisms, produces antihypertensive effect, and the effect of two drugs is potentiated, and the sum of the combination or the combination therapy is greater than the sum of the individual effects of the drugs. The next example, combination of tyramine and MAO inhibitors. The most common MAO inhibitor toxicity results from interaction with tyramine-rich food. Tyramine is an indirectly acting sympathomimetic agent, so it does not directly stimulate the adrenergic receptors, but it increases the release of catecholamines, causing a sympathomimetic effect. MAO inhibitors inhibit MAO enzyme, which causes degradation of catecholamines. So, MAO inhibitors increase the storage and release of catecholamines, so the sympathomimetic effect gets accentuated. Tyramine, by causing release of catecholamines, and MAO inhibitors, by preventing degradation of catecholamines, enhance the pharmacologic effect, resulting in hypertensive episode, which is rapid in onset. This brings us to the end of the topic. These are my references. Thanks for watching. Please like, subscribe and share.